Hello, I'm Joel Brill. I am the CPT and RUC advisor for the American Gastroenterological Association. And on behalf of the American College of Gastroenterology, the American Society for Gastrointestinal Endoscopy, and the American Gastroenterological Association, welcome to this webinar on understanding the RUC survey process. During the next few moments' time, we will go over the RUC survey process, and we'll go over survey basics, the purpose of the survey, who does what. We'll break down the survey into 7 easy steps. We'll go over questions and what happens next. You may ask, why are these surveys being conducted? The gastroenterology societies need your help to assure relative values will be accurately and fairly presented to the Centers for Medicare and Medicaid Services during this revision process. This is important to you and other physicians because these values determine the rate at which Medicare and other payers reimburse for procedures. For this series of surveys, your responses are due by March 14th at midnight Pacific Daylight Time. You will not be able to submit survey responses after the deadline because the survey data must be analyzed before it can be submitted to the RUC with the recommendations from the GI societies. Now, the purpose of the survey is to obtain estimates of the time and complexity required in performing a procedure and to obtain an estimate of a recommended professional work value. The survey asks you to compare the time, complexity, and physician work of the surveyed procedures to an existing procedure. A list of potential reference procedures is provided for comparison purposes. The surveys are being conducted by the AGA, the ASGE, and the ACG on the following procedures. Now, based on data from the surveys, the societies will recommend a work value to the RUC on 3 existing EGD codes. In the ERCP family, 7 existing and 5 new codes. And in the EUS family, 7 existing and 1 new code. What codes are being surveyed? The existing EGD codes are 43240, EGD with pseudocystic drainage, 43246, EGD with percutaneous gastrostomy, and 43251, EGD with snare. The existing EUS codes are 43231, esophagoscopy with EUS, and 43232, esophagoscopy, EUS, and fine needle aspiration. Code 43237, EGD with EUS limited to the esophagus, 43238, EGD, EUS limited to the esophagus and FNA, 43259, EGD with EUS, and 43242, EGD with EUS and FNA are being surveyed. In addition, there is a new EUS code 43225X3, EGD, EUS, and celiac plexus. The existing ERCP codes are those in the series of 43260 through 43265, as well as 43273. The new ERCP codes are 43227X4 for ERCP with stent placement, 43227X5 ERCP with foreign body removal, 43227X6 ERCP with stent exchange, 43227X7 ERCP with balloon dilation, and 43227X8 ERCP with ablation. Who does what? The AMA Specialty Society RVS Update Committee, or the RUC, oversees the survey process of the codes. The RUC will make recommendations regarding physician work and practice expense values to CMS. The specialty societies coordinate the process for the respective professions. They distribute the work surveys to members to obtain physician work and practice expense data, and they submit survey results to the RUC. The specialty societies submit the recommendations to the RUC as mentioned for physician work, practice expense inputs, and professional liability insurance crosswalks for each code that is surveyed. The recommendations are presented to the RUC meetings. They occur 3 times a year, and the next meeting is coming up at the end of April. The RUC sends its recommendations for these work values, practice expense inputs, and liability insurance crosswalks to Medicare in May. These recommendations remain confidential until CMS publishes the final rule in November. The values then go into effect in January of the following year. So we'll now kind of go over the RUC survey in the following 7 steps. Step 1, reviewing the code descriptor and vignette. Step 2 is reviewing the introduction and completing your contact information. Step 3, identify a reference procedure. Step 4, estimate your time. Step 5, compare the survey procedure to a reference procedure. Step 6 asks questions about moderate sedation. And Step 7 asks you to estimate the work RVU, or relative value. Step 1. The vignette describes a typical clinical scenario for the procedure. Now, you may have performed the procedure on a patient different than the typical one described in the vignette, and that's okay. You can still use your experience to guide your responses. So we ask you to complete the survey instrument using the typical patient described in the vignette. At the same time, the survey instrument allows you to indicate if you do not believe the vignette provided describes your typical patient. You will be prompted to provide us a description of your typical patient. In Step 2, you will review the introduction, and we ask you to complete your contact information. Please note that even though contact and basic practice information is being collected, your name is never forwarded to the AMA, nor is it used for any tracking purposes. If you have any questions about the survey, you can contact Society staff, Leslie Narramore at the AGA, Sam Reynolds at the ASGE, and Brad Conway at the ACG. Their phone numbers and emails are visible here on the slide. In Step 3, we'll ask you to identify a reference procedure. Now, you will be provided with a list of reference service procedures, and we invite you to select a procedure from the list that is most similar in time and work to the new or revised CPT code descriptor and the typical patient and service described. The reference procedure you select does not have to be equal in work in your judgment to the surveyed procedure, but it should be similar in work. In Step 4, we'll ask you to estimate your time. Using the vignette for the surveyed service, please estimate how much time to the minute that it takes you to perform the procedure for the typical patient. While certain patients may require additional time and effort, the survey is intended to estimate the work for the typical patient, and your estimate should be based on your personal experience. The pre-service period includes the physician services provided from the day before the operative procedure until the time of the operative procedure. The administration of moderate sedation is included in the pre-service period. What is included in the pre-service period? It includes an assessment of the patient's status for indications, contraindications, and fitness to undergo the endoscopy procedure. It may include procedural workup, review of records, communicating with other professionals, patient and family, coordinating scheduling and preparation and obtaining consent, dressing, scrubbing, and waiting before the operative procedure, preparing the patient and needed equipment for the operative procedure, positioning the patient, and other non-first scope in to last scope out work in the operative room is also part of the pre-service period. The pre-service period includes an assessment of the patient's fitness for administration of moderate sedation, if personally administered or supervised by the endoscopist. It includes all time for the administration of moderate sedation, from the first dose administered until the endoscopic procedure begins, if necessary, if personally administered or supervised by the endoscopist, including management of sedation. The pre-service period does not include consultation or evaluation at which the decision to provide the procedure was made. It does not include distinct evaluation and management services provided in addition to the procedure. It does not include mandated services, nor does it include staff time, such as for scheduling the procedure or for providing instructions. The intra-service period includes all physician first scope in to last scope out work that is a necessary part of the procedure. And the post-service period includes physician services provided on the day of the procedure after the procedure has been performed. So the post-service period includes this non-first scope in to last scope out work in the operative room, patient stabilization in the recovery room or special unit, communicating with the patient and other professionals, including written and telephonic reports and orders, and patient visits on the day of the operative procedure. It includes an assessment for fitness to discharge from the procedure area when performed by the physician. And it includes discharge instructions and counseling to the patient and caregivers when performed by the physician. The post-service period does not include unrelated evaluation and management services provided during the post-operative period. It does not include a return to the operating room for a related procedure during the post-operative period. It does not include unrelated procedures or services performed by the same physician during the post-operative period, and it does not include calling the patient to communicate results of laboratory tests. Now, in the next step, you will be asked to compare the complexity or intensity of the surveyed service with the reference service that you have selected in terms of the following four components: time, mental effort and judgment, technical skill, physical effort, and psychological stress. Physician work does not include services provided by support staff who are employed by your practice and cannot bill separately. And that includes registered nurses, licensed practical or vocational nurses, medical secretaries, receptionists, and technicians. In the next step, we ask about moderate sedation. This is a service provided by the operating physician or under the direct supervision of the physician performing the procedure to allow for the sedation of the patient with or without analgesia. For the purposes of the RUC survey, sedation and analgesia delivered separately by an anesthesiologist not performing the primary procedure is not considered moderate sedation. In Step 7, you are asked to estimate the work RVU. This is a very important final step where you are asked to consider the value assigned to the reference procedure in developing your estimate. The survey methodology attempts to set the work RVU of the procedure relative to the work RVU of the comparable and established reference procedure. You're at the end. How are the surveys conducted? The surveys are being conducted online. Look for an email from gastro.org at softekdc.com with the subject line, GI Survey for CPT code XXXXX. Please don't forget to check your spam folder because this link is specifically for you. If you have a colleague who would like to complete the survey, please ask them to email their information to surveys@asge.org. Again, you will receive an email message from gastro.org at softekdc.com. Embedded in the message will be links to each online survey form. By clicking on a link, you will have immediate access to all of your surveys. And please complete all surveys that you have been assigned, one for each code group. Should you have any questions, Society staff are standing by to take your questions. At the ACG, Brad Conway, bconway@gi.org, 301-263-9029. At the ASGE, Sam Reynolds, sreynolds@asge.org, 630-570-5643. And at the AGA, Leslie Narramore, Narramore, LNARRAMORE @gastro.org, 410-349-7455. Thank you again for your participation. Have a great day.